Hello friends, welcome to our YouTube channel, Kachpal A Learnings. In this video we are going to study about the topic, monophasic dosage form. So let's start. Contents covered in this video are definition, advantages, disadvantages, and preparation of gargles, mouthwash, throat paint, ear drop, nasal drop, enema, syrups, elixirs, liniments, and lotions. First, let's see what is monophasic liquid dosage form. A monophasic liquid dosage form refers to a type of pharmaceutical formulation where the liquid medication consists of a single, uniform phase throughout the container. In simpler terms, it means that the liquid is uniform in composition and doesn't separate into distinct layers or phases when at rest. Monophasic liquid dosage forms are often preferred because they are easy to dispense, measure, and administer accurately. Examples of monophasic liquid dosage forms include solutions, syrups, elixirs, and suspensions where the drug is uniformly dispersed in the liquid medium. These formulations are commonly used for oral administration, and they can be designed to have a specific concentration of active pharmaceutical ingredient, API, to ensure accurate dosing. In contrast, biphasic or multiphasic liquid dosage forms might consist of multiple layers or phases that can separate over time, requiring shaking or mixing before administration to ensure even distribution of the active ingredient. Advantages. First, uniform distribution. Monophasic dosage forms ensure a uniform distribution of the active ingredient throughout the formulation. This consistency leads to accurate dosing and predictable therapeutic effects. Second, easy administration. Monophasic formulations are often easy to measure, dispense, and administer, making them suitable for various patient populations, including children and the elderly. Third, stability. These dosage forms are generally more stable and less prone to separation or settling of components, ensuring that the desired concentration of the active ingredient remains consistent over time. Fourth, convenient storage. Monophasic formulations are less likely to require shaking or special handling before use, which makes them convenient for storage and administration. Fifth, better palatability. For oral dosage forms like syrups and elixirs, the uniform distribution of flavoring agents and sweeteners helps improve taste and patient acceptance. Disadvantages. First, limited compatibility. Some active ingredients might not be soluble or stable in certain monophasic formulations, limiting the range of drugs that can be effectively formulated in this way. Second, lower flexibility. Monophasic dosage forms might not be suitable for all types of drug delivery, as some medications require biphasic or multiparticulate systems for specific release patterns. Third, need for solubility. For active ingredients that have limited solubility in the chosen solvent or base, achieving a stable monophasic formulation can be challenging. Fourth, palatability issues. While monophasic dosage forms like syrups and elixirs can be made more palatable, taste preferences can still vary among patients, potentially affecting patient compliance. Fifth, thickening agents. For formulations requiring a certain viscosity, the addition of thickening agents might be necessary, which can impact the clarity or texture of the final product. Preparations of monophasic dosage form. First, gargles. Definition. Gargles are medicated solutions used to cleanse and soothe the throat. They are used by rinsing the mouth and throat and then spitting out the solution. Uses. Gargles are used to relieve sore throats, reduce inflammation, and maintain oral hygiene. Example ingredients: benzalkonium chloride, antiseptic, glycerin, soothing agent, mint flavor. Preparation. Measure 100 ml of purified water. Dissolve 0.1% benzalkonium chloride and 5% glycerin in the water while stirring. Add a few drops of mint flavor for a pleasant taste. Mix thoroughly until all ingredients are dissolved. Filter the solution to remove any undissolved particles. Package the gargle solution in labeled containers. Second, mouthwashes. Definition. Mouthwashes are solutions used to freshen the mouth, control bad breath, and improve oral hygiene. Uses. Mouthwashes help maintain oral health by killing bacteria, reducing plaque, and providing a fresh feeling. Example ingredients: chlorhexidine gluconate, antiseptic, fluoride, peppermint oil, flavor. Preparation. Measure 200 ml of alcohol-based solution. Dissolve 0.12% chlorhexidine gluconate and 0.05% sodium fluoride in the solution. Add a few drops of peppermint oil for flavor. Mix well until all ingredients are uniformly distributed. Package the mouthwash in labeled bottles. Third, throat paint. Definition. Throat paints are viscous solutions used to coat and soothe the throat. Uses. Throat paints provide relief from sore throats and irritation. Example ingredients: lidocaine, anesthetic, povidone iodine, antiseptic, sucrose syrup. Preparation. Measure 50 ml of sucrose syrup. Dissolve 2% lidocaine and 1% povidone iodine in the syrup while stirring. Mix until the active ingredients are completely dissolved. Adjust the fur to around 6 using citric acid solution. Package the throat paint in labeled containers with a suitable applicator. Fourth, eardrops. Definition. Eardrops are solutions used for treating ear infections or wax buildup. Uses. Eardrops help clear infections and soften earwax for easier removal. Example ingredients: acetic acid, wax dissolving agent, ciprofloxacin, antibiotic, propylene glycol, solvent. Preparation. Measure 10 ml of propylene glycol. Dissolve 2% acetic acid and 0.3% ciprofloxacin in the propylene glycol. Mix well until the ingredients are fully dissolved. Package the eardrops in sterile dropper bottles. Fifth, nasal drops. Definition. Nasal drops are solutions used to relieve nasal congestion or deliver medications. Uses. Nasal drops help alleviate congestion and administer drugs through the nasal passages. Example ingredients: oxymetazoline, decongestant, sodium chloride, saline solution. Preparation. Measure 30 ml of distilled water. Dissolve 0.05% oxymetazoline and 0.9% sodium chloride in the water. Mix until the ingredients are fully dissolved. Package the nasal drops in sterile dropper bottles. Sixth, enemas. Definition. Enemas are liquid solutions introduced into the rectum for various purposes, such as bowel evacuation, administration of medication, or diagnostic procedures. Uses. Enemas are used to relieve constipation, administer medications locally, or prepare for certain medical procedures. Example ingredients: docusate sodium, stool softener, bisacodyl, stimulant laxative, purified water. Preparation. Measure 120 ml of purified water. Dissolve 0.5% docusate sodium and 10 mg bisacodyl in the water while stirring. Mix until the ingredients are fully dissolved. Package the enema solution in a sterile container with a suitable nozzle. 7. Syrups and elixirs. Definition. Syrups and elixirs are sweetened, flavored liquid formulations for oral administration of medications. Uses. Syrups and elixirs are used to deliver medications in a palatable form, especially for children or those who have difficulty swallowing tablets. Example ingredients: diphenhydramine, antihistamine, pseudoephedrine, decongestant, simple syrup, sweetening agent. Preparation. Measure 200 ml of alcohol-based solution. Dissolve 0.12% chlorhexidine gluconate and 0.05% sodium fluoride in the solution. Add a few drops of peppermint oil for flavor. Mix well until all ingredients are uniformly distributed. Package the mouthwash in labeled bottles. 8. Liniments. Definition. Liniments are liquid formulations used for external application to the skin, often for pain relief or muscle relaxation. Uses: liniments provide localized relief from pain, soreness, or inflammation. Example ingredients: methyl salicylate, analgesic; menthol, cooling agent; isopropyl alcohol, solvent. Preparation: measure 100 ml of isopropyl alcohol. Dissolve 20% methyl salicylate and 10% menthol in the alcohol. Mix until the ingredients are well dispersed. Package the liniment in labeled bottles with a suitable applicator. 9th. Lotions. Definition: lotions are liquid formulations applied to the skin for various purposes, such as moisturizing, soothing, or delivering medications. Uses: lotions are used to hydrate the skin, treat skin conditions, or provide relief from itching and irritation. Example ingredients: hydrocortisone, anti-inflammatory; aloe vera gel, soothing agent; glycerin, moisturizer. Preparation: measure 100 ml of aloe vera gel. Dissolve 1% hydrocortisone and 5% glycerin in the gel. Mix until all ingredients are uniformly dispersed. Package the lotion in labeled bottles with a pump dispenser. Now last, guideline for packaging and labeling of the monophasic dosage form. Packaging: use appropriate containers made of materials compatible with the formulation, glass, plastic, etc. Choose containers with a secure closure, such as caps, dropper tops, or pump dispensers, to prevent leakage and contamination. Ensure containers are sterile or properly sanitized, especially for nasal drops, ear drops, and enemas. Labeling: in this, first, clearly display the name of the product, generic and brand name, if applicable. Second, include the active ingredients, their strengths, and quantities in the formulation. Third, indicate the intended use and directions for use. Fourth, include any warnings, precautions, or contraindications. Fifth, specify storage conditions, temperature, light exposure, etc. Sixth, include the manufacturing date and expiration date, if applicable. Seventh, add a batch or lot number for quality control and tracking. Eighth, display the manufacturer's name, address, and contact information. Ninth, include any necessary regulatory or legal information. Thanks for watching this video. If this is helpful for you, then please kindly subscribe the channel. Thank you.